Welcome back, everybody. My name is Mamta. I'm with GCNF, the Global Child Nutrition Foundation, who is bringing to you the Global Child Nutrition Forum, our annual affair that brings together stakeholders working in the field of child nutrition, particularly school meals every year. We host it in a different country in partnership with the host country government, as well as with the World Food Programme Center of Excellence. And as you know, we are living in unprecedented times. So this year we bring the event virtually. We've had sessions for the last 2 weeks. And this is our final week going into where there have been a lot of focus on the Asia region particularly. So we're really pleased to have everyone. Today's session is the third of the technical session titled Return to School: What Changes Are Needed to Deliver School Nutrition Safely When Schools Open, the Early Experiences and Look into the Future. 10 months into the pandemic, we know that there are several countries still, including my home country where I'm based in Nepal, schools are closed. But our earlier session today, we had a country sharing session and we saw many countries in the region, including Thailand, Bhutan, who shared experiences of their schools opening. So from an esteemed lineup of speakers that we have for this particular session, we will be hearing expertise on the broader thematic areas, but also examples from countries. The forum theme, as you probably, I feel it's a lot of usual suspects that we have on this particular session. I'm sure you're familiar with the theme already, which is the new world of school feeding, more important than ever. So without further ado, I am going to make the introduction of our first speaker, Professor Donald Bundy. Again, I always make this question. Those of you who've seen that name, I am sure you're familiar with a lot of literature that's out there for school feeding, has been authored by Professor Bundy. He's the Professor of Epidemiology and Development at the London School of Hygiene and Tropical Medicine. He has worked for more than 30 years on the role of school health and nutrition programs in the development of school-age children and adolescent, especially in poor countries. He currently serves as senior advisor to the World Food Programme in Rome and also advises the Children's Investment Fund Foundation in London, the World Bank in Washington, DC, and several national governments. Before joining the London School, he was deputy director and senior advisor to the global health team of the Bill and Melinda Gates Foundation, and as lead health specialist at the World Bank in Washington, DC. Professor Donald has authored more than 390 books and scientific publications and has also produced award-winning documentary films on the role of public health in development, including the series for PBS. He has founded the Partnership for Child Development based in UK, which was recognized as best practices in the UK Parliamentary Review. He has contributed to all 3 editions of the World Bank's Disease Control Priorities since 1993, and in the current edition, especially highlighting Volume 8, which focuses on child and adolescent health and development. So without further ado, I will invite Professor Bundy to take us through where he will present on how the pandemic offers opportunities to look at the challenges that can be converted to opportunities, and especially focusing on school meals as a safety net. So over to you, Professor Bundy. Welcome, and thank you so much for making time to be with us.
Well, a big thank you to you, Mamta, for that very kind introduction, and a big thank you also to GCNF. I'm trying to, I'm a man and I'm trying to do 2 things at the same time here. I'm trying to start up my my slideshow. Is it working? Have I managed to get that out there? Can you see the slides?
Yes.
Yeah. Okay. Great. Yeah. Big thank you to you, Mamta. Big thank you to GCNF for putting together this virtual meeting. It's been extraordinary times for all of us. That's why it's a virtual meeting. It's all our lives have been changed, and just for transparency, I should say that I'm a COVID survivor myself, so I have a personal interest in in all of this. It's affected it very early on in the first March event. And I'm going to give a presentation around to kind of set the scene a little bit, and it's based on one that I was asked to give to the American Society for Nutrition. I was asked last year, and to focus on why school feeding, why focus on children 5 to 9 year olds, school-age children, in terms of school feeding. By the time I gave the presentation in May, of course, it was COVID had arrived, and school feeding was history in many countries, and that made us understand why school feeding was even more important now than it had been before. So that's what I'm going to do is, first of all, talk a bit about why school feeding, and then a bit about why it's even more important to talk about school feeding in terms of COVID. And the data I'm going to rely on are from the disease control priorities that volume 8. And if you want a copy of that, you just download it. It's www.dcp-3.org. dcp-3.org. And you really, when you get there, you want volume 8, which is about child and adolescent health and development. And pretty well most of the data that I'm going to be talking about will be from there if you want to follow up on that. One of the things that I often find when I talk to people about school health and school feeding is that they think it's a sort of niche area, sort of specialist group, which is of course entirely not the case. And if we think about 2020, this year, one of the things that happened this year is that the world's average age exceeded 30 for the first time. That's the average age of people in this world. The average age in the States is, I think, 39, and in the UK it's 40. The North is older. But in the South, there are countries like Chad, like Niger, where the average age is actually 15. That's the average age of the population. And some of those populations, the proportion of people over 60 is 3 or 4%. And what this tells you is we have a massive difference in demographics across the world. But if we're worried about school children, worrying about children in the South is absolutely a crucial issue. And understanding that demographic, so in the North, you may have 12% of the children, 12% of the population being children that are targeted. In the South, it might be as many as over 40% of the children. So this is far from a niche issue. This is a massive issue that affects billions of hundreds of millions of children. And in trying to understand it, here's a graph that's just looking at the age along the x-axis, going from 0, from conception through to about 20 years of age. So it's a 20-year span, and looking at what happens during those 20 years of development. So that's going from being a baby to being an adult. What goes on during that period? Well, we've always focused, I think, in the development world, we've always focused on the first 1,000 days of that journey, but it's an 8,000-day journey. It's 8,000 days from 0 through to 20, and the first 1,000 days really vitally important. And if we look at the top graph here, which is about height, we can see all of this tremendous height gain, tremendous growth that goes on in that early part of life. But we can see that during the next 7,000 days, so after the first 1,000 days, next 7,000 days, we can see growth is still going on. And we can see that around the adolescent growth spurt, there's quite dramatic increases in growth. And they're different for males and females. And one of the other things that we realize that's different is that you're much bigger then. These are young people going into adolescence. And yet they're showing the same sorts of growth rates as they last saw when they were 2 years of age. So dramatic changes in biomass. What does that mean? That means we need to think differently about their diets and about the way we care for children during those times of change. And the example of growth is just a particularly clear-cut one. The other two graphs are actually about brain development. Now, when I was first taught about brain development, we had this idea that when you were born, children had big heads because the brain was pretty well fully baked at that point. That turns out to be more or less true for the biomass of the brain. The brain doesn't physically get very much larger, but there's dramatic changes that go on inside the brain. And those are all the brain development changes that that we think of as that particularly happen in late adolescence, and we think of as adolescent behavior. So the purpose of this sort of graph, and a lot of the work reported in DCP3, is simply to say there's actually 8,000 days of development. The first 1,000 days absolutely critical, as we've always said, but there's another 7,000 days, and we've been rather neglecting that. So to look at that in another way, here's what that means. Take a life cycle view. First 1,000 days, lots of things we need to do there. I don't think I need to go over that. In the next 7,000 days, we need to continue investing. We need to maintain those early gains. We need to offer opportunities for catch up when children haven't benefited early on. And also there are actual vulnerable phases during adolescence and puberty that we need to take care of. So this changes the picture, and it's that 7,000 days picture which we are investing in with school feeding, with school health, and with school health and nutrition. And so we talk about an 8,000 day paradigm, the 1,000 days plus the next 7,000 days. And what else is important about those next 7,000 days? And this is really the third point on this slide, is that that's when education happens. That's the period we really need to worry about, because that's when we invest most in educating children. But what do we do, in fact, in terms of our health investments? Well, this is a graph looking only at low and lower middle income countries and looking at the children there. How do we invest? How does the world invest in these children? Well, under 5, there's an investment of around $29 billion a year for those children. Much of that investment is in health, and as I've said already, that's very important. It's not enough, but it's very important that there's an early investment. But what happens after the age of 5 is that there's this really huge investment in education. Again, it's not enough. I'm not suggesting that the solutions are there. It's not enough, but it's huge. $210 billion a year in education globally in this group. But in health, it's somewhere between 3 and 4 billion is going into the health of a year of these school children. And that's not enough. It's a mismatch. We're failing to invest in the children when they're growing. We're failing to invest in the learner at the time they're learning. And that's an issue. So that's really why school feeding has an important role to play, why school health and nutrition has an important role to play. And just to emphasize some of that, this is the World Bank's metric of human capital index, showing human capital indices for the whole of the world, for most of the countries in the world, and showing that over on the right, if we look at gross domestic product, if we look at the countries that are the rich countries, the high income countries, we can see that the human capital, the value of the human population is really high. That and perhaps I should just say, so we have something called financial capital, which we're all familiar with that term, but this is human capital, the value of people. And what this is saying is that in rich countries, something like 70% of their wealth comes from what the people create. Whereas in the poorest countries, it's 30 or 40%, which is a double tragedy. First, it's a tragedy because it means the poorest countries are really not benefiting from one of their great strengths, their people. And secondly, the people as individuals are not achieving their full potential in life. So again, we need to invest in people during their growth, and that's what school feeding and school health and nutrition does. So let's pass through an important feature of growing up, what we're now calling the nutrition transition. This thing that's happened in the world that's beyond COVID, happened in the background there. This slide is simply to illustrate it. On the left, we've got fresh foods, fresh fruits and so forth. On the right, we've got processed foods. And the stuff on the right is more what's being marketed and more what's available. And that's really happening worldwide. There's a huge change in nutrition. Don't have to tell you all that. And the consequence of that is this, that overweight and obesity prevalence continues to rise in all regions of the world. It's not exclusive to to rich countries is now all of the regions of the world. In fact, it's growing fastest in the poorest countries because they start from a lower base. And so there's something that's happening during school age when there's a real opportunity to make a difference, and where school feeding can start to set dietary behaviors that can have lifelong value and benefit. Because this obesity and these conditions, obesity is obviously terrible for COVID, but it's also terrible for a whole range of non-communicable disease areas in later life. So that's why we need to be caring about investing in children during those 7,000 days. How do we invest in them? Well, we use the school as a platform. This is a nice little figure, I like it. It's really to illustrate this idea of fresh, focusing resources on effective school health. Schools are a community. They provide an opportunity to do lots of things to help children at that age. But one has to be careful that one doesn't disrupt education in that process. This was launched, Fresh was launched in 2000. Last year, UNESCO led a stepping up around this area, stepping up of effective school health and nutrition, a new partnership with all of the UN agencies involved. And so all of this promising stuff, and I've been focusing particularly on human capital and on health and on education, but I also want to just point out that school feeding programs clearly, and there's good evidence now, have big impacts in terms of social protection in particular, in terms of rural economies, providing support to agriculture, and also to peace building. And I think that it's no coincidence that the World Food Programme was awarded the 2020 Nobel Prize for Peace. Part of that role is certainly about investing in children in conflict and emergencies. So here we have all of these investments, and then I'm just going to move forward, and then COVID-19 arrives, and what happens? 192 countries closed their schools, 1.5 billion children no longer have access to education, 368 million children no longer being fed. This is in April, May, and some 400 million no longer getting their school health and nutrition supplementary activities like deworming and mental hygiene management and so on and so on. So the closure of schools stopped all of this, and we have data here from, this is the World Food Programme's data showing it's a global phenomenon. What's the impact? Well, if you listen to those presentations that were done earlier today, you saw that all of these bad outcomes have now happened, that children who are out of school are marginalized and stay out of school, that girls are much more likely to get married. That's what's happening. Girls become also much more likely to be pregnant, much more likely to be abused. Child labor increases. Poor educational attainment, that's the obvious one, with terrible consequences for future earnings. So lots of things went wrong. The initial response, there was a tremendous response to this globally, tremendous response by the countries, by the agencies, and we'll hear more about some of those things. But it turned out this was a really hard thing to do. You can't easily replace schools in terms of education. In Africa, for example, providing online education didn't reach 90% of the children. Equally, trying to provide cash transfers and take-home rations was great as a coping and mitigating mechanism, but really in terms of reaching the children was much less successful than doing it through schools. For example, the WFP, this is a map of their response. WFP were able to, with very much renewed effort, increasing costs, still unable to reach more than about half of the children they've been able to reach using the school mechanism. So the clear action now is get back to school. And we're going to hear much more about that from my other colleagues. So we'll also hear more about guidance notes. So I'm going to stop at that point. Thank you all. The big thing that we want to talk about today is how do we get back to schools? How do we respond to COVID? And one of the key parts of that is putting school feeding back, because it's a huge incentive for children to go to school, a huge incentive for parents to send them to school, and also an extraordinary opportunity to reach all the children on a daily basis. So thank you very much.
Thank you, Professor, so much. It's always, it's always fascinating. The more numbers that we see through the research that you've been conducting in the field, there's so much to learn. And quite frankly, as you have put it, there is a great deal of opportunity to invest in the learning. We invest in the learning, but not in the learner. And certainly one thing the pandemic has also taught us is where nutrition plays a key role in terms of building our immunity and moving forward, where school feeding as a social protection safety net has opportunities to build on that as well. So if you can stay with us, we'll come back to the question and answer segment later. I will move on to our next speaker, but before that, I want to confirm we have Mr. Bhaskar with us because please bear, we've had some technical issues. So Mr. Bhaskar, could you turn on your mic and confirm with us that you are on the panel? Otherwise, we can make sure that we bring you in.
Pouvoir donc participer.
Mr. Bhaskar, can you hear us?
Yeah,
are you with us?
Yeah, I'm here. I'm in.
Nous entendre?
Okay, very good. I also want to very quickly mention that we have an interpreter service. If you go to the bottom of your screen, you'll see a globe icon. You can toggle between English, which we're conducting the session in. We do have interpreter in French. You can switch to that. Especially we've seen in these sessions we have friends and colleagues joining in from Africa and other places, French-speaking places. Okay, so without further ado, I am going to welcome Mr. Vijay Bhaskar, who's the director at the Ministry of Education, Government of India. Mr. Bhaskar, we know you have a lot of things on your plate, a lot of priority agenda items. We really appreciate you making time to be with us today. Mr. Bhaskar, he was a seasoned bureaucrat and a long-time champion of school health initiatives. He has been managing the midday meal schemes portfolio, the largest school feeding program in the world, feeding over 100 million children every day. This was one of the questions we also had earlier in the session today. And I must say, not everybody got it correctly. So Mr. Bhaskar, this is an opportunity for you to amplify what we already know you're doing so well in India. Mr. Bhaskar was instrumental in promoting school nutrition garden in schools. And since the pandemic hit, he's been on the ground and has been taken a very special initiative for the provision of food security allowance distribution under midday meals, which is the school feeding program in India. We're truly delighted to have him on the panel with us and look forward to the learning and leadership that India can share with the rest of the global community in managing the program of this scale. Mr. Bhaskar's presentation is going to, of course, focus on India's experience in operating the largest program, the school feeding program, and the challenges that clearly come with it in the context of the pandemic. So Mr. Bhaskar, welcome, and I turn the floor over to you.
Thank you, Mamta. I'll share the screen for a presentation to make. Yeah, is the presentation in full screen mode? Yeah.
Yes, sir. Yes, sir.
Yeah, a very good afternoon to all of you, the distinguished guest speakers and all the participants in this afternoon's meeting. A very good afternoon once again, and then Subedi for the participant from Laos, the host country for this year, supposed to be, if it is the normal non-COVID days. Anyway, midday meal scheme is the largest known meal program in the world. We serve 116 million manifestations of God in so many children studying in our classes. In our Indian tradition, we say Annam Parabrahmam. That means food is the divine form. Food is the form of the divine. Food is a form of the divine because we are made of food. We are what we eat. We are made of food. Food is a part of God. So with that, I'd like to start my presentation. I invoke all those 116 million gods in the children that we are privileged enough and blessed enough to serve in this country. Yeah. In India, in fact, the school meal program, we call it midday meal program, it is backed by an act of the parliament, act of the legislature of the nation. Though we started it in sometime in 1995, we have enacted an act, a law of the land, sometime in 2013. We call it National Food Security Act. It makes the midday meal scheme a right-based program. Every child who is coming to school, studying up to 8th standard, that's elementary school, we call it in this country, is entitled, it's his right or her right to get a meal, hot cooked meal in the school. So Section 5 mandates that, and it gives a right to the child. And we follow a life cycle approach. All our children are of the age group of 6 to 14, and they're supposed to get a minimum RDA, recommended dietary allowance. So we have a premier institution in this country called National Institute of Nutrition. We have scientifically calculated that because we are giving only one meal of a day to the child out of 3 meals, so we should at least give 1/3 of the RDA. That means 450 kilocalories, 450 kilocalories of energy and 12 grams of protein to a primary child, that is grades 1 to 5 child, and for the children of grade 6 to 8, 700 calories and 20 of energy and 20 grams of protein. How do you provide that? We provide that using these food norms. We have, it's there to read, for the primary child, this is 100 grams of food grains. We generally use rice and wheat, that are the staple food grains in this country, and then pulses 20 grams, vegetables 50 grams, oil and fat 5 grams. Do you see a pattern here between the primary and upper primary? It's upper primary is straight away 1.5 times. It's 1.5 times of what a primary child gets. And to buy this, the Government of India provides something called cooking cost. I'll come to that a little later. These are the objectives of midday meal scheme. We have, as I already said, 116 million manifestations of God studying in my schools, in government schools and government aided schools. So it's our primary responsibility to take care of God. It's not enough to give prasad, to give offerings to God in your temple. The schools are our temples, and we are supposed to give nutrition to all our students coming to the schools. So this is the primary objective of midday meal scheme. And of course, through this, we want to encourage all of them to attend schools more regularly. You'll be surprised, or you may not be surprised to know that even till date, a large number of children for whom this is the only meal that they get of a day. It is pathetic. We still have these kind of inequalities in this world. But that's the reality. Reality is very bitter, but it is the reality. The meal a child gets in the school is the only meal several lakhs, several millions of children get. Then the third objective is, it is not only in the normal school days, we also provide midday meal, that is school meal, even during the summer holidays, summer vacation time, if in a particular district or in a particular state, in a particular province, there is a drought in that place. Drought means what? Drought means loss of livelihoods. And all my children are from, generally, most of the children are from deprived backgrounds. So if their parents lose their livelihoods, at least it's a responsibility to give them meal, at least one meal during the drought time. So that's our third objective. These are the numbers, kind of mind-boggling to people who have never seen these kind of numbers. And these are just not just numbers. These are people, so many souls, 116 million souls studying in 1.13 million schools. You just imagine, not many countries have their total population, which is anywhere close to 116 million. Imagine the kind of feat that this country pulls off by providing one meal, of course, to so many manifestations of God. I keep repeating this because I want to drive home this point. The students coming to our school are not so-called poor children or underprivileged children. They are the manifestations of God that we have a responsibility and a duty to serve. And you know how much quantity of food grains that we use. We use 2.7 million metric tons of food grains. Someone can do a small calculation. If we place those bags of 50 kg of rice one after the other, maybe it will cover the distance between India and China or India and America. I don't know. I'm just guessing. Someone can do this for me, please, and tell us by the end of the presentation. If we keep a bag of 50 kg, all the bags that 2.7 million metric tons comprise of, 50 kg bag would be of 2 feet, 60 centimeters. So if we keep them one after the other, how far it will go? Or maybe we can reach the moon if we keep them one on the other. Well, that's not the point. And another great thing about this scheme is we involve 2.5 million Bhojan Matas, the mothers that cook food. We call them cook-cam helpers. Of course, we provide them very little compensation because we don't consider them as employees. We consider them as honorary workers. And 95% of these 2.5 million are women. So I feel very good in announcing that so many of them are women. And at the same time, I feel very not so happy that we provide them paltry compensation. That's a different matter. Cooking cost. I was mentioning earlier, for providing 50 grams of vegetables, 20 grams of pulses, 5 grams of oil and other condiments, we give per day per child 4.97 rupees, INR, Indian rupees, 4.97. That's close to 5 rupees, with which one buys vegetables, pulses, and oil and condiments. And of course, it includes the cost of fuel also. And we're very happy with the intervention of the central government. Most of the places we have liquefied petroleum gas stoves. They're LPG stoves. Of course, in some interior areas, we do use wood-fired stoves. That's for another this thing. And for the upper primary classes, that is grade 6 to 8, we provide per child per day 7.45 rupees. You look at those eyes of those children in this picture. These are the children who are having midday meal in our schools. Just keep that in your mind. Yeah, in the midday meal scheme, it's not just giving food. It's not just filling the tummy of a child that comes to the school. We also have a holistic perspective. We take care of the health aspect also in convergence with our Ministry of Health and Family Welfare. This slide, it says it all. I don't have to read out each one. We do carry out health checkups to the children at least once in a year and occasionally twice in a year. We provide deworming tablets all across the country on one day in February and on another day in August. One day in 1.1 million schools to give deworming tablets to 116 souls on one day, February 10th, and another day, that is once in 6 months basically, and the other one is August 10th, once in 6 months. It's a gigantic exercise that we do in convergence with Ministry of Health and Family Welfare. We're proud of it. We are proud of it because it helps the children that are coming to our schools do better. And simultaneously, we also give them IFA tablets, iron and folic acid tablets. It's given weekly and it is under supervision. It's not that it's given just like that and then kid is allowed to throw it out. Not like that. It is done under supervision. And we also have Mission Indradhanush. Basically, the immunization program. We do celebrate in every September the birth month of our Honorable Prime Minister. We call it Poshan Mah, that is the nutrition month. We carry out lots of activities in this month. We drive home the point that we need to take care of the children and their nutrition so that our nation becomes better. That is how we build our human capital. We've just carried out certain quiz contests and meme making contests. This is just the fun part of it. Large number of activities have been carried out under this nutrition month. These are just numbers. These numbers look very small when we talk about 116 million kids. 5820 children participated in meme. That looks smaller, but it is huge when we compare with other nations. And of course, as I was introduced in the beginning, we have started a couple of years back school nutrition gardens. Not that we've started it afresh, it has been there for ages, but we have given it kind of a structured way. Now we're doing it in a structured manner. Now we're proud to announce that almost 3 lakh schools in this country have school nutrition gardens. See the child. See the swag in her. They have produced some food that they're going to eat. You are producing something that you are eating. How many of us can brag about this? How many of us can claim that we produce part of what we're consuming? Almost none. None of us. We only buy from a departmental store. We don't know how food grows. Of course, some of you might be doing it in the windowsills and all that. That's micro. That's very micro. So we're proud of our children. In 3 lakh schools, that is 0.3 million schools, we have school nutrition gardens. I told this earlier. Now, sometime in March 2020, this country has woken up to this COVID pandemic. Sad, sad, sad. Very, very bad. We've got our schools closed. Schools were closed by the middle of March. That was a jolt. It is a serious jolt. As Professor Bundy was talking earlier, there was a serious digital divide. Kids not having access to electronic devices. They are simply left out. But of course, we have moved in. The government of India and the state governments have quickly moved in. We have done all possible methods. We've used all possible methods, right from the television to radio, to community radio. Teachers themselves have pitched in, used social media, used WhatsApp, Facebook, internet to reach out to some people who have got at least the digital devices. Otherwise, teachers have gone to villages, used loudspeakers to teach children. This is a nation which takes care of its children. We value our children because in them we have our human capital. And what have we done in COVID response for the midday meal scheme? Because the school is closed, there's no kitchen, kid can't come to school. How will you provide him meal? Yes, we can, we will, and we did. We did provide dry rations to all the 116 souls. Of course, we have provided only one meal. We have provided ration that is sufficient for one meal. But one meal is definitely better than no meal. I think all of you would agree with me. And remember, COVID pandemic it really agonized people. People are all anguished. People have lost their livelihoods. Millions of people have lost their livelihoods. Imagine you have lost your livelihood. You don't have enough to eat, but at least your child is getting something to eat from the school in the form of a dry ration that you can cook and give it to your child. That is the blessing that we people in the midday meal scheme in this country are doing. We're proud of it, and we consider that we are blessed in a way to serve God through this. What have we done? We've done this. We have told all our provinces, we have used an enabling clause in the National Food Security Act that if the school is closed, your meal scheme won't be closed. We have positively and constructively interpreted it. We have interpreted in such a manner that we have to take care of these children, because if you don't take care of your children in their such a difficult times, who will? And what are you good for them? You means the government. But we proved in this country, the central government and the provincial governments, we've all worked in tandem, worked with full synchronicity, and we've ensured that every child gets his due. Every child is served his midday meal. Though it is not cooked, whatever is his or her, every girl child, every boy child of a school, they all were given food security allowance. What is food security allowance? Food security allowance is that 100 grams or 150 grams of rice or wheat and stuff, that is pulses, oil, or a mix of both, or a combination of both, which is worth 5 rupees. For example, for a month, you have 20 working days. That means 20 multiplied by 500 rupees. A child will get 100 rupees worth of pulses. Pulses are a good source of protein. So 100 rupees worth of pulses means almost 2 kilograms. Along with that, child will also get 100 grams of rice for every day. That is 2 kilograms. 2 kilograms of rice and pulses. This really helped them at least to maintain their nutrition status, because this is the time when they are supposed to maintain, not only maintain the nutritional status, they have to take care of the immunity. Immunity has to be intact. So we are proud to say that in this country, we have served so many million souls, 116 million. I drive home this point again and again. Bear with me, 116 million souls is not a simple thing. We have done this because there is a synchronous effort from the provinces and the central government. And what have we invested? Not much. In terms of the size of our nation, in terms of the size of our budget, and in terms of the size of our expenditure, overall expenditure, it's great, but we consider this not as an expenditure. We consider this as an investment. As Professor Bundy was telling us earlier, human capital building. We are investing this in building the human capital. And what are the numbers here? $200 billion rupees we have put in from the central government and 80 billion rupees from the provincial governments. That's 280 billion rupees to serve these many gods, albeit only one meal a day, but one is better than none. And we didn't stop there. We didn't stop there. You would be really happy, all your people with your hearts in the right place, and all your good Samaritans, you would be very happy to know that for the first time in the history of this country, we have provided dry ration. Of course, we're not in a position to provide cooked meal. We have provided dry ration to all the children for the summer holidays, vacation period also. This is the first time that it's happening. This is the first time that it happened. Because you can't say, this is a normal, regular summer holiday. It's a summer vacation time, so I won't take care of the children's nutrition. No, it is our responsibility. We should take care of their nutrition needs. So we did. We did take care of their nutrition needs. Even for the summer holidays, which generally last about 45 days in this country, we have provided the children with dry ration. These are some glimpses that we have gathered from the provinces. See what's happening here. This is the province of Karnataka in the southern part of the country. Children lined up in social distanced lines, and they are here in the school to collect the food security allowance. See, isn't this heartening? Isn't this really warming up your hearts? It does. See the children. See the mothers collecting food rations from the school. And we didn't stop there. Wherever it is not possible for the parents to come to the school, we went to the parents. We, our teachers, our workers, our volunteers, they went to the house, they went to the homes of the children and delivered the food which is a part of God to the children who are parts of God. This is another state. It's one, some of them are from Karnataka and some of them from some other states. See how people are waiting for the food security allowance packets to be distributed. This is in the state of Chhattisgarh. Chhattisgarh is a unique state. You know, Chhattisgarh is in the central part of the country, wooded. It's a wooded state, full of forests, and almost half of the population is from simple societies. You know what you call tribal societies. They are from simple societies. This picture is from one of those simple society villages where the women self-help group people. These are our cutting edge level last line ambassadors. They have taken so much of risk to work during the COVID pandemic time. See the women there. They are packing pulses, soya chunks, oil, and they're packing in pre-decided quantities. And these things were distributed to people in their homes. See the picture on the right. Things are ready to be distributed. Here's the distribution happening. Kids have come to, you see the children, you see their attire, you see these are the children of Bharat. These are the children of real India. But we are fortunate to serve them here. See the happiness in those children on the top left. They have got something when they are expecting nothing. This is what is delighting your God is all about. We are fortunate enough to delight our gods. Because everybody was under the impression that schools are closed, there won't be any midday meal. No, we didn't agree. And God was with us to help his children. This is the state of Andhra Pradesh, again in the southern part of the country. See the child getting eggs, rice, and jaggery and peanut cakes. That's full of protein. The whole thing is full of protein. And then it wasn't done just like that. You know, if you see the right bottom picture, see the marking in English. You know, pictures were taken. These are ring-fenced pictures. Latitude, longitude were taken in that pictures just to ensure that things are reaching the right beneficiaries. See, this is how we have done. This is what we have done to so many gods in this country. Well, coming to reopening of schools, we've issued some guidelines. We have got experts' opinions. These are all standard things. You know, we need to do deep cleaning of the kitchens. Things should be in order. Canteens, kitchens, washrooms, everything should be cleaned up. Storerooms, dining area should be sanitized. These are all common sense things. I don't dwell much on this because these are all common sense things. We've already advised our provinces that they should be ready with these things, and they are gearing up because we are gearing up to reopen the schools. Although, you know, in this country, we have class sizes of big numbers. You know, the class will comprise of 40, 50 students. But because of the COVID pandemic, we want to have social distancing, and then we will be opening classes for alternate days, and then class size would be minimized. Even if the class size is 40, we will invite only 20 children on one day, another 20 in another day, like that. Any ideas, you can tell us a little later. And here is our website, mdm.nic.in. These children, using this website, we of course reach to all the states and provinces. See the smile on this child's face. Very adorable, very endearing. And before I end my presentation, I leave you with this thought. Please take 10 seconds just to watch the eyes of those two children. Those two girl children, just see their eyes, where their hands are. Just absorb that picture. This is God talking to each other, God talking to its own constituents, and God entering his own self, her own self, its own self. They are having midday meals in their school. And We in this country consider every meal to a child is an offering to the divine, and we are all part of the divine. Stay blessed. Thank you so much.
Thank you, Mr. Bhaskar. And indeed, I do have a big smile on my face as I look at those as those photos that you shared. We appreciate the passion with which you've shared, your experience and what you're doing in India. Just looking at the numbers, it is a monumental task. So commendable, and kudos to you, your team, and the government of India. I hope you'll stay around because I am sure there'll be questions that come your way, and we're particularly keen to understand with the federal structure where it's a centralized and a decentralized model, how you've been able to overcome those challenges, because just thinking about it alone, it's quite overwhelming for many of the other countries that have been joining the conversation. You mentioned rightfully the largest program, and comparing that to the second largest school feeding program that through the global survey we've been able to discern is Brazil. And was pointed out earlier, the population of Brazil is the size of Uttar Pradesh, which is a state in India. So we clearly know the challenges that you have ahead of you, and we are along with you, looking forward to learn some of those best practices in overcoming those challenges. So thank you so much, Mr. Bhaskar. So I will now invite our next speaker. Let me change the slide. And I must also disclose out here, Cornelia has been a little under the weather, but yet is braving it to be with us. Cornelia, or Nelia in short, is the Chief of Party for Catholic Relief Services, CRS, learning and engaging all in primary school in Laos. The main agenda is to ensure program fidelity and quality so that all students in the 350 schools that they operate in have a hot lunch and an improved learning environment. Nelia has started a career as a Spanish and world history teacher in all-girls school in the US. After completing a master's degree in international education at New York University, she worked on various research projects, studying the impact of education globally. She worked as a project director for a study in Ghana, for example, examining female teacher leadership and girls' access to education. She then transitioned to the role of a research director for a randomized controlled trial in Afghanistan, measuring the effect of community-based education. She's been with CRS in Laos since 2018. Cornelia is going to focus on the global experience in supporting country governments respond and to school nutrition, especially in integrating the pandemic response, and we'll be giving specific examples from Laos. So Cornelia, the floor is yours. I turn it over to you.
Okay, thanks Mamta for that introduction. And I'm really pleased to be here. I think I am the new kid on the block on this panel. So I'm thrilled to be here, and thank you for GCNF for pulling this together. And just to confirm, my screen is visible?
Yes.
Okay, great. So good day, everybody. I'm really happy to be speaking on behalf of CRS's school feeding programs. And specifically how our school feeding programs have adapted to school closures during COVID, what our programs have done to prepare and facilitate reopening of schools, and specifically where we see improvements, how to better prepare for the future. So to provide just a little bit of background for what CRS does in terms of our school feeding, CRS does have 60+ years of experience. We started school feeding back in the 1960s in West Africa, and we've grown over the years. So in 2021, we will serve meals to 650,000 students across 9 countries, and our school feeding programs are supported by the United States Department of Agriculture, the McGovern-Dole Food for Education program. All of our school feeding programs have a very concentrated support on local ownership of school feeding through increased capacity and commitment. And so this takes the form at the national level with supporting school feeding kind of nationally at the different countries, but also working with the communities for the day-to-day management of school meals at the school level. So we do work in 9 different countries currently across Central America, West Africa, and Southeast Asia, the one program Laos, which I currently represent. And I do kind of want to preface this presentation by saying that the impacts of COVID have varied greatly from country to country. In some areas, schools do remain closed, which is the case in Guatemala and Honduras, but in West Africa and in Laos, schools have reopened. The reopening of schools, I think it's really important to point out, because it does affect school meals and learning outcomes as well, is that often when schools are reopening, governments have prioritized really kind of a catch-up period to make up what was missed during school closures. For CRS, our school feeding focuses on pre-primary and primary level. So what we saw is that governments were prioritizing return of grades based on different exam schedules. So what we saw is that lower grades, and especially pre-K, were the last to return to school. And because of this approach, I think it's worth noting that there could be potential negative impacts, specifically on marginalized groups, girls and younger children, who rely on school meals in order to access school, but also for their daily nutritional intake. So while we may be kind of working to rush to get kids back into school, I think the order of how we are prioritizing kids' re-entry to school is worth noting, and making sure that our programs are paying specific attention to this so that we can support these groups specifically. So when schools did close in most of our countries, this happened in March, which is kind of the global trend when the COVID pandemic did hit. We saw our programs really transition activities in 4 main areas. So the first was transitioning from school meals to take-home rations. And I think this was really important, and I think the fast action of doing this was really important, specifically in Laos and in West Africa, because school closures were happening during the hunger season or the lean season. So this is when school meals are the most important to these children and to their families. So in this case, we saw that the THRs were helping to combat food insecurity. But one of the other issues that we did see, and this was mentioned in an earlier GCNF presentation, is that we're starting to see families also go back to kind of a more of a staple diet that's not as diverse as it previously had been. So I think there was some concern that the THRs, while they're being distributed, may not have been delivering the full extent of the nutritional diversity that was needed at home without the additional additions of vegetables, fruits, proteins, eggs, etc., which does happen at the school level. So one way that Guatemala specifically worked to kind of combat this issue was that they worked with the Ministry of Education to connect to local farmers so that there were fresh vegetables that were included in the take-home ration, in addition to the in-kind commodities from USDA. The second way our programs adapted was through kind of home learning materials. So we know that school meals play a really important role in investing in the nutrition and the health of the learner, but all of our programs also focus on learning outcomes as well. So this took a variety of approaches across our different school feeding programs. Some of these were paper-based, but then others were also technology-driven. So the use of radio, internet, and smartphone. So many of our communities are in the most rural areas, so we wanted to make sure that students that didn't have access to radio or smartphone and self-service also did get access to home learning materials, and these often were in paper-based forms. One example was from our Sierra Leone project. They worked with the Ministry of Education on their radio programming, and also worked with the Ministry of Education to increase radio transmission to the more rural areas, and also provided solar radios so that their project participants could continue to access lessons while schools were closed. Thirdly, our programs distributed hygiene kits to students, hand washing kits to schools, and then cleaning materials to schools as well to help schools reopen. So in Laos here, we provided cleaning materials to schools so that the school compounds could be cleaned when schools did reopen, which happened in June. and that schools could put in place a regular cleaning protocol so that schools were cleaned on a daily basis. And then lastly, there was the transitioning of trainings, monitoring, and outreach with travel restrictions and putting staff and project participant safety first. All CRS programs needed to transition kind of our normal way of doing things, which is often kind of direct outreach and travel to the field. So monitoring and outreach all went digital to varying degrees across our project. So in the case of Honduras, they actually adapted one of their key nutrition trainings for parents to include kind of a self-directed model that include videos on WhatsApp and on YouTube, but also kind of a paper-based learning guide. And then they were assessed using Google Forms in order to get their certificate. So when I was speaking to the other project directors and COPs and talking about what allowed our projects to adapt as quickly as we were able to, there was 4 main themes. So the first one was the work with national governments and the ministries of education. So I think there was, when schools did close, there was a call to action. And this included obviously education actors at the government level, UN agencies, and development partners to see how we could best serve the participants in the schools in which we work. So in the case of Laos, we worked with the Ministry of Education and Sports COVID-19 Task Force, which is really our key entry point to make sure that we could get the necessary government approvals in order to make our programming adaptation. So the task force consisted of development partners and relevant government staff, and it was really in these meetings that priorities and needs were set, and then kind of together as a group, we identified who could do what and where we could do it. We also worked really closely with WFP, and I think this was a key success. WFP, the ministry, and CRS are the 3 main school meal implementers in the country. So we wanted to make sure that our approach during school closures was standardized. So we were successful and able to do that. And together we were able to complete the process of starting the THR distributions and then also making sure to communicate out with the schools and the communities. The next main point was work with kind of a broad range of stakeholders. So this would be other school meals implementers, food producers, private sector. So we saw this happening at the small scale, but this is something that obviously could be improved upon, and especially as we're looking towards kind of contingency plans for the future. So we did see some of our programs, specifically Guatemala, work with local food producers, again, to get produce, fresh produce into that THR basket. The flexibility of our donors, specifically USDA, was really important. They were very supportive of us working and adapting our programming to make sure that programming did continue in these unprecedented times, and really working with us to kind of brainstorm and troubleshoot any issues related to agreements, programming, and then also budget reallocation. And then lastly, as I mentioned in the previous slide, use of technology. All of us have become a lot more familiar with it. It is successful sometimes and then a little bit of a headache for others, but it really has allowed us to continue our trainings and making sure that we are able to communicate with our communities so that school meals could continue as soon as schools reopened and that the THR distributions were able to happen during closures. So as I mentioned, again, there's a large variability in kind of where our current programming is and the current conditions in each of our countries. So some of our countries, there are heavy government restrictions and regulations, such as Honduras and in Guatemala. Laos is on the other end of the spectrum, where everything has reopened and is operating almost close to normal. So really how we opened or supported the reopening of schools depended heavily on context. So in the case where schools are still closed, Guatemala and Honduras, take-home rations are continuing to be distributed. And in countries where schools are open, there's been additional hygiene trainings for cooks and school staff, food preparation trainings, additional cleaning protocols for student bowls, canteens, kitchens, rotating lunch times so that the number of students in the canteen is reduced to respect social distancing. And there's an increased emphasis on hand washing for students and for school staff. There's also been an increased focus on wash. This is something that we've seen globally. So hand washing has been the most prevalent and noticeable up to this point. But I think really the key is the collaboration that's happened between education and health departments in order to put in place the infrastructure for hand washing, but also kind of messaging around hand washing, COVID prevention measures. And so I think this is kind of an area of growth that we've seen that hopefully will continue into the future, because this kind of cross-sectoral collaboration is really important. And then lastly, similar to the THR diversity that I mentioned earlier, we don't have empirical data yet, but 3 of our 9 countries that have opened have all kind of cited that there is some concern about the dietary diversity of school meals, and that this actually may be impacted when schools do reopen. So our programs really rely on kind of the support and contributions for communities, for fresh vegetables, fruit, protein, eggs, etc., to make sure that it's rounding out the nutritional value of the meals in addition to the in-kind commodities that are provided. So with this, so there is going to need to be additional work to make sure that there is an increased emphasis on additional contributions. So during the school closure, a couple of things that we did see happen: school gardens went unattended. While school gardens don't provide kind of the whole necessary food basket, they are important kind of supplemental materials to feed into school meals. So school gardens were not operational when schools did reopen. And there's also the additional economic impact of COVID, especially on our communities and the families. So we're seeing an increased economic stress on families, and therefore their inability to contribute at the same level to the school meals as they had done previously. So looking at moving forward and what is needed, I think one thing that came out clearly from all of our programs was a national, provincial, and community level contingency plan that responds to future school closures. So whether this is for COVID-19 or other crises that may be happening globally, it would be beneficial that we start thinking now about this so we are ready for the situation again in the future. So a couple of things to consider within this contingency plan. The first would be the THR basket and really focusing on the dietary diversity. So if families are going back to a more staple diet, how can we work with the school community to ensure that school meals and the THR continue to meet the nutritional requirements, especially knowing that students may not be getting a full nutritiously diverse meal at home. The second is in the contingency plan, considering timing of closures. Like I mentioned earlier, our closures really did happen during a lean season or the hunger season in many of our countries. So how can we make sure the plan is fast to respond, specifically for those that need it the most? Thirdly, the inclusion of a wider group of stakeholders. So this goes back to government, private sector, food producers, and we're all part of the solution. So how do we begin to kind of make those connections so that we can kind of collaborate if schools close in the future? Fourthly, there will often be other external factors influencing food insecurity in the countries that we do work. So if there are school closures and we are having to adapt school meals or distribute THR, how are we making sure we are responding to those that need it the most? So for example, in Laos, we had heavy flooding that impacted a large percentage of our target area not too long ago. So how do we actually work with those communities to make sure that school meals and THR baskets are reaching those most in need that may be impacted by other external factors? And then lastly, I think it's really important to note school meals is an important part of the school community, and so is learning. So how do we make sure that we are continuing to support learning during school closures, and specifically preparing parents, school communities, village education committees so that they can support learning if schools are not in session. And then lastly, this is a larger question that I think a lot of the school meals community has been grappling with for a while, but how do we encourage more cross-sectoral collaboration? For school meals, it's essential that health, education, social protection, agriculture are all coordinating, since each sector plays a really important role in school meals at the school level. So this goes back to what Professor Bundy was mentioning kind of with the fresh graphic that he presented. and how can we make sure that all of these sectors are collaborating, but how can we also view schools as kind of a central area that students and families can access a lot of these social services? Because what we do see schools often use is either emergency response centers, but also kind of meeting places in times of crisis and emergency. So I think all in all, CRS programming has been able to adapt to the school closures and has been able to adapt to the early reopening of schools, but there is a lot of work that continues and needs to be done, specifically to prepare if there are future closures, and that when schools do reopen, that meals continue safely, and that meals continue to meet the education and nutrition needs of the children that we serve. Thanks very much.
Thank you so much, Nelia. I think your presentation, you really drive home the importance of partnership, particularly with the host countries where different organizations may be operating, but also the importance of partnership with other stakeholders like WFP you mentioned, and others, the private sectors, donor community. And another thing that you did highlight is also the importance of talking to donors in terms of the flexibility with the fund allocations. Please do stick around. I know you aren't feeling that well, but we'll try to speed it up in the Q&A. I do want to move now to our final speaker for this particular panel, and special kudos for joining us really early hours from New York is Ms. Deepika Sharma. She's a public health nutritionist with extensive experience working on systems strengthening and policy advocacy. She leads UNICEF's global portfolio on nutrition of school-age children and adolescents at UNICEF headquarters in New York. She provides technical support to UNICEF's 7 regions towards scaling up the school nutrition work, including the regional offices, which is based in Kathmandu, Nepal. She also has experience of working with the government public health system quite extensively, and has worked with various international organizations on gender, adolescent nutrition, reproductive and sexual health, and life skills. Deepika is a Ford Foundation Fellow and holds an MPH from Tulane School of Public Health and Tropical Medicine, as well as a master's in business management. In a presentation, Deepika is going to round off what we've been hearing a lot, that many of partners and governments have been responding and adapting. There is much still to be done, and there is a global call to action that is being put forth. So she's going to walk us through some of that. Welcome, Deepika, the floor is yours.
Thank you. Hello, everyone, and thanks, Mamta, for the intros, and also inviting me for this presentation to share the global momentum and how, from the global perspective, how countries have adapted. The internet, it's sad, but the internet at my place is a bit patchy, so I'll be just projecting the slides and switching off my video. Sorry, just a second. So to avoid any glitches. Do you see my slides?
Yes, just put it full scale.
Yes, I'm just doing that. Yes. So, well, being the last in the entire panel is kind of it's a bit difficult job, because the stalwarts have already spoken, but nevertheless I will try. So in my presentation I am going to focus on a few things. Just to recap on situation pre-COVID, which I think Professor Bundy also spoke about, the guidance landscape, the landscape on school health and nutrition guidance across the globe. then how school health and nutrition has been integrated in response, recovery, and reopening plans. What are some case studies and examples, and then we can leave it to the discussion. So just to give you a brief overview of how was the situation pre-COVID. I think it was eight months ago. Seems like a lifetime, but if you see the global situation of children 5 to 19 years of age, anemia has been a major serious public health problem, and iron deficiency anemia has been leading cause of morbidity among adolescents. And the prevalence of anemia, this is just a range in Middle East and North Africa region, is 16%, and on the other hand of the spectrum is the South Asia region with the high prevalence of 54% among adolescents, and this is between the age group of 15 to 19 years. Then we see about thinness, which is a measure of undernutrition. So girls, 74 million girls are thin, and around 117 million boys suffer from thinness, which, as you all know, is defined by a BMI for age, Z-score, which is less than -2 And then we move on to the other end of the spectrum, which is overweight. So you can see that there is a huge burden of overweight in children in middle childhood as well as adolescents. 131 million children overweight, and when we talk about adolescents 10 to 19 years of age, 207 million children, or 17.3% of the total population, world's adolescent population, is overweight. And this most importantly, it's for we are working in various countries in many settings, and we every day we witness different forms of malnutrition overlap in the same community, households, and in the same neighborhoods. um, from here we move on to the next slide, which is about a landscape of school health and nutrition programs across the globe. So this I have taken from the Global Nutrition Policy Review that was done by WHO. And here you can see that the picture looks quite green and rosy, that nearly every region, these regions are WHO World Regions. So nearly all regions have school health and nutrition programs running. So the job is all done. But let's then disaggregate it and see what's happening. So if you see that across the various regions too, not all countries have school health and nutrition programs that address all forms of malnutrition. So in a country, there might be high burden of stunting or thinness, wasting, micronutrient deficiencies, overweight and obesity, but not all countries are working towards addressing all forms of malnutrition. Some countries are focusing just on, say, wasting, micronutrient deficiencies, and others are focusing on childhood overweight and obesity. Let's see further. And here, if we try to unpack school health and nutrition, so we see that okay, 89% of those countries, the N was 160, 89% of those countries have any kind of school health and nutrition program. But if you see, most of the countries really don't have a comprehensive school health and nutrition program. When I'm talking about a comprehensive school health and nutrition program, I think I'm just talking to the converts, but still just to drive home the point. Countries may be just working on school feeding, take-home ration, but not working on micronutrient supplementation despite a high prevalence of anemia among school-age children. In countries where there is which are facing the triple burden of malnutrition, they may not be having adequate provisions for safe and healthy food environments in schools. So none of the countries have got a very comprehensive set of interventions to address nutrition among school-age children. So that was pre-COVID. And now let's see how the pandemic has exacerbated the situation. Around 1.6 billion learners have been affected, and across 190 countries. 370 million school children are not receiving adequate diets and adequate nutrition to grow well and to learn well. And pandemic, we have seen from Ebola and other various emergencies that any kind of emergency or pandemic heightens the disparities, and especially among girls. There is a tendency to drop out and never coming back to schools. And this is the same thing that happened in Ebola. And as of now, we don't have a very robust data set on how many children have dropped out due to COVID, but this is inevitable in certain regions if no action is taken. The cost of inaction is very high. And also across the globe, this information has been drawn from various apps, fitness and Fitbit apps, and it points out that there is diminished movement behavior among school-age children, which again increases the risk of sedentary lifestyle and overweight and obesity, which is a risk for COVID. Although children are less likely to die of any overweight and obesity or presenting symptoms of COVID, but still, it's a big risk. Sedentary lifestyle is a big risk among children and will have implications later in life. And this. Just sharing an excerpt from a study. According to a study in South Korea, it was also observed that the screen, due to online learning, remote learning, distant learning, the screen time had also increased among children, which has impact on sleep patterns as well as lifestyle and mood. So if you look at this space, when we talk about nutrition of school health and nutrition, or nutrition of school children, school-age children, adolescents, a lot of thoughts come to our mind that in a package, what all should be there? We talk about safe environment, we talk about diets, we talk about wash interventions, we talk about healthy environments, safe operation, safe and healthy school food environments. Countries also talk about working with food handlers, food vendors, building resilience, building the capacity of teachers, school feeding, improving the curriculum. When distant learning is there, at least children get some information on how to maintain hygiene as well as healthy diets and continue physical activity. So there are a lot of aspects that need to be covered in a package, and the package has to be, any package that is being proposed or is being designed has to be very comprehensive. So just to give you all an overview, I'm sure most of you might have seen the various guidances that are there, but I've just tried to give you an overview of the various guidances, the documents, the policy brief, the advocacy briefs, and the tools that are available to integrate school health and nutrition in COVID response. So when it all started in March, well, in some countries it started earlier, but I would say in March, and then there was this guidance released by UNICEF, WHO, and the FRC, and which talked about engaging school administrators, community, school children, parents to build a whole school approach and but the emphasis was just on safe and clean environment. So in this guidance, you may have seen that there is less emphasis on continuity, maintaining the continuity of school health and nutrition, but it was a good start. This guidance also talked about assessing, adapting, and acting according to the context. So a global guidance was there, but it had to be adapted to the local context. And this guidance contained information and on age-appropriate educational activity and messages. And the guidance also, which is I think the foundation of any kind of work or any kind of response that is to be generated or conceptualized. Also, so this guidance also talked about ensuring intersectoral convergence between various ministries and also uniform messages. Um, in around in April, FAO, WFP, and we at UNICEF, we worked together to develop a guidance on how to maintain the continuity of school nutrition programs in various settings. The guidance talks about what can be done when schools are closed and what is to be done where schools are open. So how to generate that response in both the context. This guidance was developed in, as I mentioned, in collaboration with the other organizations like WFP and FAO, who have extensive experience in this area. And these guidance have also been adapted by various regions. This is available in French, Spanish, as well as Arabic. Then further in April, again, there was, so there are two communities working, you might see from the various guidances. So there's a community of educationists, which are working on framework of reopening of schools. Then there is a community of nutritionists and health professionals, which are who are trying to advocate and navigate that space so that school health and nutrition is integrated into the various policy briefs that are coming for reopening of schools, that are coming out, or that are being developed for response plans on from the education sector. I think this is a major milestone because convergence is the key. Nutritionists, health professionals need to work with the education sector, and education sector needs to work. It's all complementary. So the skills both the sector have and can contribute to improve learner's life and also enrich the learning experience. So this guidance focuses on the importance of safe operations, learning, including the most marginalized, and well-being and protection. And again, this guidance was also was for 3 phases, as in when schools are closed, response, and recovery. And there was also mention, I've just highlighted that here, there was a mention of continuity, the need to continue school health and nutrition services when such plans are being developed. After this, a checklist has also been developed, which is very helpful. In the last slide, I provided all the links, so you may find the links very useful for your work in the various countries. This checklist has a section on well-being and protection and safe operations, and which talks about reestablishing regular and safe delivery of essential services, focusing on nutrition, wash, health services, continuation of school feeding, vaccination, and protection and referrals and services for children with disabilities. So addressing the disparities. This checklist also talks about equipping teachers, building the capacity to address mental health issues and psychosocial needs of the learners. And also, this guidance focuses or emphasizes on training the administrative staff to ensure physical distancing and school hygiene practices, because they are quintessential to any kind of recovery plans.
And then most recently, I'm referring to what Mamta also mentioned, that most recently a call to action has been released by UNESCO, WFP, WHO, and with UNICEF, urging all the various partners and global leaders to come together to invest in school health and nutrition at all levels, so that a robust recovery plan is established for children, and this generation is not lost. This call to action focuses on inclusion of school health and nutrition in the response plans and the recovery plans, and it also talks about factoring in access to health and nutrition services. So it mentions continuity of school meals, micronutrient supplementation, health services, wash, and social protection. Based on all the various guidance and the momentum, the global momentum on that has been there, various countries have adapted these guidance and come up with their regional guidance or checklist, which have been very useful for various countries. And these are just examples from a few countries across the globe. Like Mexico has developed a public-private partnership model where they're distributing food baskets, because in one of the guidance, in all of the guidance, it has been emphasized that continuity of nutrition services, school meals should be there. So what are those alternate mechanisms? So Mexico has come up with this idea of food baskets and vouchers to families, especially the in the vulnerable areas. In Brazil, there has been more focus on communication activities and promotion of healthy eating and uh, active and promotion of active lifestyle. Brazil is a country grappling with severe overweight and obesity issues, so among school age children and adolescents. So and using communication media and young people, the network of young people is being very successful over there. Similarly, Latin America, the continent, is also has UNICEF has supported learning at home methodology, where digital channels are used to provide free educational and entertainment messages on good health and hygiene practices. In Ghana, the UNICEF is supporting Department of Health, the Ministry of Health, and the Ghana Health Services and the Ghana Education Services to maintain the continuity and distribution of iron folic acid. This is one of their flagship program to prevent anemia among adolescents. So this program was earlier run through schools, but now because of school closures, there is an alternate mechanism for distributing IFA supplementation through health workers and community mobilization platforms. Similarly, in Zimbabwe, UNICEF has worked with a group of young mobilizers and young people's network to generate awareness through media, through social media, and creating various digital apps to promote messages around hygiene, social distancing, wearing a mask, and maintaining healthy diets and active lifestyles. So, all in all, I can say that nearly every region across the globe has adapted the various global guidance to their context and come up with their most innovative models. So, what are the learnings at the global level that we have observed? We really don't have any data as of now, because a robust analysis was done on how COVID is going to have an impact on wasting. That was released a few months ago. But as of now, we really don't have any robust data set on the impact of COVID on micronutrient deficiencies or nutritional status of school age children and adolescents. However, there are other learnings that we can I can share with you. This has established comprehensive, this has led us to establish a comprehensive and multi-layered measures. Like, for example, each and every country and region is suggesting to the government to take action at the policy level, at the organizational or school level, community, and individuals. So across the various guidance, you will see that there is a commonality. The various organizations are trying to address the socio-ecological model. So COVID response, recovery plans targeting individuals, targeting community, targeting schools, targeting teachers, targeting policies, provisions and investments to be made for all these levels. Engaging community in the reopening plans has been very successful, and this is the same experience that the countries had when they were grappling or dealing with the Ebola pandemic. Uh, Another major learning is that most of the organizations like WHO, UNICEF, WFP, FAO, and various others have come together to have a uniform coordinated response. So you may be seeing a common guideline, a common advocacy brief, a common call to action, rather than having duplicative response, which has been very useful for countries. And the basic premise of all this work that has been going on and support that has been provided is to build back better through an integrated approach where school health and nutrition is integrated into the education responsive plans. And most importantly, the key is contextualizing the various technical tools, the guidance, sharing, learning, and building the knowledge exchange like we are doing here. So yeah, so that's the last slide of my presentation. And thank you very much, Mamta, for providing me this opportunity to share the global perspective. Over from my side. Thanks.
Absolutely. Thank you so much, Deepika, for all those resources you've shared. I'm sure it'll be useful, and you really, do highlight that there is a global call, but the importance of local contextualizing. And I think what you really highlighted in your presentation also was the need for convergence of the education community as well as the nutrition community in bridging some of the gaps that's there. I know we're over time already. This happens when there is so much of expertise and learning to be had. But if I can urge everyone just to stay on, because I know there are some interesting questions that have come up. So we'll dive right into it. Meanwhile, I'd like to invite all of the panelists to come back wherever you may be, which I'm guessing you are still in the session with us, because I do see all of you there. We'll start with the first question that is directed to, and to everybody who's there. If there are questions, please do put it up in the Q&A tab. The first comment and question is to Mr. Bhaskar. Mr. Bhaskar, we have our colleague, Dr. Kalana from Sri Lanka, who says, excellent presentation, Mr. Bhaskar. The work you're doing is huge, and I'm sure you must be facing a lot of challenges in the current situation. His question is, have you already thought of undertaking some ways in which you can measure the nutritional status of the children, so you know that they're nutritionally on track during the school closure for COVID? So do you want to tackle that question?
Yeah. Thank you so much for the compliments. Well, we take it seriously. We think that because they are our children, I pardon me because I keep repeating this. They are a part of us and we are a part of them. Children's nutrition measurement is what Dr. wants to know. Right now, we don't have a structured way of measuring the nutritional status as such, but it's happening indirectly, because in the form of Rashtriya Bal Swasthya Karyakram, National Child Health Program. It's actually the entire health component, not just nutritional aspect. Once in a year, the doctors from the nearby primary health center visit the schools, take the basic measurements of the children, BMI index and things like that, and they do maintain a health card in the school, wherein the health parameters are mentioned, or the readings were taken, and then it is monitored. And it is not specifically for nutrition, but yes, health point of view, it is being done. However, we want to take it forward. Going forward, we want to have some sort of a baseline study, and then what kind of an impact the midday meal scheme had on the children. We'll have an endline study. Of course, there is a lacuna here because we provide the children only one meal a day. the child is having 2 more meals at home or elsewhere. So the causality may not be direct, but yes, it does matter. And then we are in the process of setting up something like that. I hope, though it is a little longish, but it helps in understanding the whole perspective. Thank you.
Thank you, Mr. Bhaskar. So we'll dive right into the other. There are 2, which is specific to mitigating sharing at household level when we do the take-home ration model. So I guess we can open it up to Cornelia, to you, Mr. Bhaskar, and to Professor Bundy, as well as to Deepika, perhaps. So there's a question around this, as well as in French. And while I have been able to polish my French, Mamadou also poses a similar question. How can we know that the ration intended for students will be consumed by the student and not by the whole family? So both Julian and Mamadou asks about that. Perhaps we can start with Cornelia, since you all are doing a lot of on the ground work, and then come back to you, Mr. Bhaskar, and Professor Bundy and Deepika, if you'd also like to tackle this question at all. Over.
Yeah, sure. I think this is it's a good question and not one that we can 100% mitigate. I think a lot of what we did at CRS was making sure that communities and families knew that the THR rations that were being distributed were in lieu of school meals. And so we often did kind of nutrition outreach training for parents when they did pick up the rations, to make sure that they knew the importance of consumption of their children when they were at home, when school closures did happen. We did do a post-distribution monitoring survey, and we were able to confirm that 98% of the take-home rations were consumed at the household level, which I think is great to begin with, right? So we didn't actually see any of misuse of our take-home rations. I think the bigger question, and the one that we don't have data, is actually how much of our target beneficiaries were the recipients of that. Anecdotally, we do know that the take-home rations were shared among family members often. And I think when you have a situation where it is the lean season or the hunger season, I think that's a natural kind of effect that we are going to see. But through communication, I think that was the main way that we tried to mitigate it. Whether we were 100% successful, I don't have the data. But the other case in Laos is that we only did take-home rations for one distribution because schools were only closed for about a month and a half. So I think there's not a lot of information that we can glean. I think of our other programs, especially Guatemala and Honduras, that are continuing with the take-home rations. They might have additional learnings that we can share kind of with the school meals community as they continue to monitor and track how their THR rations are used.
Thank you. Mr. Bhaskar, I imagine through your operations, you mentioned that there's a lot of take-home, the dry ration. So are you all experiencing, and what are you learning from the ground?
Yeah, that's an interesting point about sharing of the ration. I'd like to say with pride that this country has done an enactment, National Food Security Act. It has 3 components. That is Integrated Child Development Scheme, that is for the children of age 0 to 6, midday meal scheme, that is for children of ages 6 to 14, and public distribution system wherein food grains are distributed using our government network for the families. So during the COVID time also, even though we're giving dry ration to the students, we continue to give free. In fact, this time the government of India has given free ration to families also. During the COVID time, we have given free ration, free of cost. You get dry ration, food grains, rice or wheat to the families. So we're 100% sure that not much of undue sharing of, I mean, if you allow me to say this, the food grains meant for the child went to the child, because the family is otherwise taken care of.
Of course. Thank you for that. And I know we have another session coming up, so I'm afraid I'll have to keep it brief. Professor Bundy, is there anything on this you'd like to comment? Otherwise, I know there's a question that's come in for Deepika, and perhaps that might have to be our last question. We can go to a wrap up. Professor Bundy, you have a long-standing experience in this research perspective, so.
Okay, let me just say a few words on this. One of the remarkable things is that school meals programs turn out to be the most extensive social protection, social safety network in the world. It's a remarkable thing. In 2008, when we had the fuel crisis and things, one of the things that we immediately learnt from that was that school meals programs were this way of reaching right into communities and helping people. And we saw that not just in low-income countries, we saw that across Europe. We were seeing countries where they were opening the schools at lunch during vacation periods so they could look after their children. So when I heard Mr. Bhaskar talking about the vacation program in India, I thought, hallelujah, what a fantastic thing. This is exactly the way to deal with it. And what also struck me, of course, in this country, in Britain, the Marcus Rashford, the striker for Manchester United football team, very famous for that, also came forward and said, we need to feed the children during COVID, during vacation, as well as during school time. And I think these are universal learnings that we need to take forward. And frankly, I hope Britain looks to India to learn a little bit more about how to deal with this on this scale. But my main point then is to say that the schools themselves are the best route, and going back to school is the key way to make this happen. But it's been fantastic how people have rallied round to cope and mitigate even during the crisis. That's the message I would leave. Getting back to school is going to be the solution.
I have a small point.
Yes, Mr. Bhaskar, please go ahead.
Yeah. Thank you, Professor Bundy, for those kind words about this country. Hallelujah. We're all together. I have a small suggestion. What Bernie Sanders has proposed in the country of the world's richest or powerful, whatever you call it, your next door neighbor. You have some suggestions for the United States of America that they should have free school meal program. You can't have a child attending school with empty stomach, and it's happening in the country which brags itself of the world's leader. Are there any thoughts from your side, Professor? And then you might have studied, being a scientist, you must have studied the Bernie Sanders proposal, which is simple, very easy, financially viable, socially possible, and it's easy to execute. And any thoughts, Professor, please?
Mr. Bhaskar, really legitimate question. And we in fact had USDA, the US Department of Agriculture, in one of the technical sessions. I'm happy to share the recordings from that, just for the purpose of keeping on track, because as I said, we have another session and I'm told I have to wrap it up in 2 minutes. Maybe I can encourage bilateral conversation there. There is one question to Deepika. I want to address that and then we come to the closing round. So Deepika, the question is around comprehensive monitoring of the nutritional status of the children 5 to 14. How do you make sure that's done correctly? Is that something in all of the resources you mentioned? There's a reference to it. Perhaps you might want to share. Over.
Yeah, thanks. That's a very relevant question, and sorry to disappoint the audience over here, because really as of now we don't have, at the global level, we don't have any robust metrics to assess the nutritional. Anthropometry is one thing, but there are other markers also to assess the nutritional status of children, middle childhood and or school age children. So that's a big difficulty, and we are grappling with it. We are working with partners to come up with the metrics, and it's not easy because there are certain countries which have adopted like global school-based health surveys, and there are other mechanisms also, but not every country has adopted that. And then that is just through a survey. But when you talk about monitoring, it has to be routine monitoring. So routine monitoring systems are not yet robust enough to assess the outcomes. So this is a huge gap, and yeah, we really need to work towards it. What we have is how many children are missing out on meals, but really what impact it has on the nutritional status, whether it, well, it's not positioned as it's positioned as a social protection program, but then we really don't have any kind of, you know, robust data tool mechanism to provide that information. And all the guidance that has been developed is mainly on the application, you know, how you can integrate school health and nutrition into the education response plan. At least we you know, we have put our foot into the door. So that's these guidance would not help address this issue, but sooner or later we should be having something, because as I mentioned, UNICEF is working with a couple of partners to come up with a robust metrics on nutrition of school-age children with various markers and anthropometry. Over from my side. Thanks.
Great, thank you. So before we get, sorry, Mr. Bhaskar, before we get kicked out, I do have to go to final comments, 20 seconds. Deepika, we'll start with you. Closing thoughts.
Well, it's been a pleasure to be part of this esteemed panel, and for me it was it was a learning, because from the I could share the global perspective on the various guidance and how we try to keep up the momentum by collaborating with partners, which is very important, and working very closely with the education sector. I think that has been the key to have robust response plans across the region and across the countries. And thanks again, Mamta, for providing me this opportunity. Thanks.
Cornelia, can we have 20 seconds final thoughts, please?
Sure. I just want to say thank you. And it's really been a pleasure to be on this panel with people that are so passionate and committed to school meals. And I think what we've seen over the past 6 to 8 months with school closures because of COVID, I think there is going to be kind of a lost generation that's going to be impacted in terms of nutrition and also learning outcomes as well. So it's been great to hear about the adaptations that people have done and the thinking that people have moving forward to make sure that these response plans are in place, and so that we can try to get children back in school as quick as possible and as safely as possible.
Thank you. Professor Bundy, 20 seconds.
Thank you so much. And thank you to all the panelists as well, and the great questions from the audience. I think one thing was very clear, there's a lot that we can learn from each other on this. There's really rich experience. This has been a great way of sharing that experience. I hope that Mr. Bhaskar and I can communicate offline and follow up on some of the questions. But I think the main message I would say, would leave you with, is we really need to reopen schools. We need to restore education, and we need to also restore vital services, including school feeding.
Thank you. And last but not the least, you know what they say, save the best for last, right? Mr. Bhaskar, 20 seconds, please. Closing thoughts.
So much. Thank you so much, Mamta. Gratitude to all the panelists. Thank you so much. I have a special request to make with the UNICEF representative, Ms. Sharma. You can't find a better partner than Government of India. We generally request UNICEF to join us in our joint review missions that we do in almost 5 states in every year. And surprisingly, no representative of UNICEF is turning up. Please look into that so that we can have a robust partnership. And then what you're talking about is actually we're doing. We are taking the anthropometric measurements of almost 1,000 children, 1,000 each from 5 states every year. And we take the baseline data and we take the data after 1 year. So, and we do request UNICEF every year. UNICEF India representative don't even turns up. So please look into that, and then we can definitely be a good partners in the service of the gods of this country.
Thank you, Mr.
Thank you so much.
Bhaskar.
Thank you, Mamta. Thank you so much for organizing this. And then I have a request to make. please use kinder words. Please show compassion. Please use kinder words. Nobody
Thank
will
you.
get
Thank
kicked
you.
out. Nobody gets
Yes,
kicked out. Meeting gets over.
absolutely.
Nobody gets kicked out. Thank you so much.
We will keep that in mind. But having said that, I do want to again thank all of our panelists for making time to join us, for sharing the wealth of knowledge that you have. And we will take in mind and be kinder, Mr. Bhaskar, and try to make this world a better place. Drawing your attention to the poll results. Not many actually got it right. The correct answer for the first one is 370 million. It's still a lot. For the second one is 1.5 billion, and quite an overwhelming majority got that correct. And the last one would have been quite embarrassing if we hadn't got it right. Indeed, it is SDG 2, which aims for zero hunger by 2030. Thank you to everybody behind the scenes, Sijo, Ryan, Roman, Mary, for making this happen, and to all of our attendees from far and near who've stayed with us beyond us having gone, I think about 25 minutes beyond our scheduled time. So have a good evening, good day, stay safe, and we will continue to have these conversations.